Good morning. Happy Friday, everyone. Welcome to another edition of PT on Ice, Fitness Fridays or Athlete Fridays. My name's Jason London. I am on faculty at the Institute for Clinical Excellence and teach the rehabilitation of the injured runner as well as rehabilitation of the injured cyclist courses or bike fitting course. Today I am going to talk about a topic that I totally like to geek out on, ski and snowboard injuries. Skiing and snowboarding is a pastime of mine that I really enjoy. I've taught skiing and snowboarding for the past 22 years, ultimately coaching slopestyle snowboarding, and then that was really an injury in snowboarding. Tearing my ACL is what brought me into the field of physical therapy, and now I have the honor of volunteering with the U.S. ski and snowboard team as a physical therapist as well. And living in Bozeman here, we are in the heart of winter, and the Olympics are just around the corner, so I thought it would be a great topic for today. Being in the heart of winter in the Northern Hemisphere, with especially in the Rockies, we do tend to see a lot of skiing and snowboarding related injuries, and winter is actually our busiest time of year at the clinic that I'm at. And getting a little bit better understanding of the mechanisms of those injuries and how to treat them can be very helpful if you're working in a ski town. So skiing and snowboarding, while they may share the same environment, are obviously very different sporting activities in terms of their mechanics and body position, where a skier is usually perpendicular, their body is perpendicular to the fall line. They have independent motion of both of their legs, whereas a snowboarder their body is going to be parallel to the fall line, and they'll be leading with one leg down the fall line, and both of their legs are fixed to the snowboard. So this, of course, results in different injury patterns for each sport. In a nutshell, skiers tend to have a lot more lower extremity injuries, whereas snowboarders tend to have a lot more upper extremity injuries. In snowboarding, probably the most common injury is a fracture to the distal radius, or a Colles fracture, typically happening in more beginner snowboarders as they're learning the sport, and if they catch their edge, particularly their heel edge, and fall backwards and try to break their fall with their hands, they end up usually with a wrist fracture, typically to the lead arm or the forward arm. More advanced snowboarders, you'll see, especially in freestyle snowboarding, slopestyle snowboarding, you're going to see much higher incidence of glenohumeral dislocations, and this is typically falling forward towards their toe edge on an outstretched arm. And rehab for that is going to be, basically your standard rehab for a glenohumeral dislocation. Typically will lead to a Bankart repair with surgery, and then later on in the rehab is when you want to get a little bit more creative, and particularly having the snowboarder be able to control their spins without getting their arm into apprehensive position. And glenohumeral dislocations are more common in skiers, particularly freestyle skiers as well. One upper extremity injury that occurs in skiers that's pretty unique to skiers is skier's thumb, or basically where they fall with their pole. The pole gets caught between their thumb and their index finger in the web space, and they end up with an ulnar collateral ligament tear, and usually actually a avulsion fracture of that. Those are good to pick up, and if you do have a skier coming into direct access and you suspect a skier's thumb injury or ulnar collateral ligament tear, it is worth them going and getting radiographs to see if there is a avulsion fracture, because that typically is going to be best treated with a surgical fixation. So upper extremity injuries account for 50% of the injuries in snowboarders, whereas lower extremity injuries account for 50% of the injuries in skiers, with ACL injuries being the top injury for sure, with the top time loss injury in skiers. And ACL injuries can occur by really four main mechanisms of injury. The most common, and historically the most common mechanism of injury, is called a phantom foot, where a skier is trying to save themselves from a fall that's usually inevitable, and they sit back in their skis, so it ends up in a backwards twisting fall, and they end up catching, their hips get below their knees, and they end up catching their inside edge, which puts an internal rotation torque on the downhill ski, or on the downhill knee, and ending in an ACL injury. So prevention for this, in terms of your education to your community, and then education to those athletes that you have in the clinic, and trying to help prevent future injuries as they go back to skiing, is telling them if they are going to fall down, or they think they're falling down, just let the fall happen, and then stay down until they come to a stop, and not trying to get back up while they're still sliding. Of course, unless they're in expert terrain and having to avoid going off a cliff or rocks or something. Another common mechanism of an ACL injury in skiing is a forward twisting fall. This typically happens in more beginner skiers when they're in a snowplow position, and they fall forward with a body twist, and the ski doesn't release in time, and they end up with an ACL injury. For those more beginner skiers, prevention of that is just making sure that their binding din or release din on their bindings is set properly. And really, even for beginners, you could have it at a 50% lesser din in terms on the number there. And just educating the patient regarding that. For more expert level skiers, having a pre-release on a ski could be just as problematic as the ski not releasing, particularly in freestyle or slopestyle skiing, or skiing in big mountain terrain. So probably not the best advice to have skiers lower their din in that setting. But for beginner skiers, for trying to prevent ACL injuries, lowering the din setting on that. Third mechanism of injury typically occurs more in freestyle skiing for the ACL is a boot-induced anterior drawer, and that is typically landing flat and then compressing down, so their hips get below their knees, and then they basically have all this backward motion of their body while their tibia stays fixed because of the hard ski boot, inducing an ACL injury. And then lastly, in World Cup ski racing, or ski racing in general, the most common mechanism of injury for ACL tear in skiing is called the slip-catch mechanism. This is a little bit similar to the phantom foot mechanism mentioned earlier, except that instead of being in a higher degree of flexion, like in the phantom foot mechanism, the slip-catch mechanism is when the skier is they lose their outside edge or downhill edge and are trying to regain control, so they extend their knee to try to get that edge back on the snow, and their inside edge catches, again resulting in an internal rotation of the tibia with an ACL injury. And a lot of times that ACL tear is going to occur before they fall at all, or they may not even fall at all with that. And so there is ongoing research on kind of trying to think of ways to prevent that currently, but I don't have any solid evidence or advice for preventing that slip-catch mechanism in alpine ski racers. ACL injuries can certainly occur in snowboarders as well. It happened to me, and like I said, that's how I got interested in the field of physical therapy. And the ACL injury the injured leg is typically going to be the lead leg, and typically it's going to happen in freestyle snowboarding, so where the snowboarder is coming off of a spin, off a jump, and landing awkwardly. Rehab for ACL injuries in skiers and snowboarders is going to start out just like any other ACL reconstruction that that you're rehabbing. However, with skiing and snowboarding, eccentric quadricep strength as well as isometric quadricep strength is extremely important. So you really want to focus on that eccentric quadricep strengthening, and then getting into Olympic lifts are going to be the best way to do that. So getting the free weights out. And if you're not familiar with Olympic lifts and the athlete is not familiar with Olympic lifts, definitely get some training on how to do that and familiarize yourself with that, because that's going to be a great way for them to strengthen their quads, but you don't want them to get injured in the process of doing Olympic lifts. A little plug here, I guess, for Institute for Clinical Excellence. A great way, if you're unfamiliar with that and treating lifting athletes, would be taking the fitness athlete courses through the Institute for Clinical Excellence with Mitch and Ryan. And there's the fitness athlete online course as well as the live courses, and they have quite a few dates for 2018. And then later on in the rehab, with snowboarders, definitely have them bring their board in and their equipment so you can look at how their stance is set up, and then you can certainly incorporate their snowboard into some of their rehab by having them do some squats on a Bosu while balanced on their snowboard, and just getting creative there. With skiers, have them bring their boots in and look at how they're positioned in terms of the cant of the boot, and do they need a footbed or not, to try to get that knee out of a valgus position when they're just in their boot in a squat. For lower extremity injuries in snowboarding, one injury that I have to mention is the lateral process of the talus fracture. This is pretty much unique to snowboarding. It occurs with about 15% of all ankle injuries to snowboarding, with less than 1% of ankle injuries in the general population. And this occurs, again, typically in freestyle snowboarding, where the snowboarder is coming off of a jump. They're getting an axial load through the ankle with some amount of dorsiflexion, and then external rotation or eversion has to occur as well. And they get what presents like a severe ankle sprain, but then have pinpoint tenderness over the lateral process of the talus. And this is an important injury to catch because it does have a high rate of non-union, or actually necrosis occurring because of an artery that can get cut with that injury to the talus. And so if you have a snowboarder presenting with a severe ankle sprain and they have tenderness over the lateral process of the talus, make sure that they get referred for imaging and having a conversation with the physician that you're sending them to, because they may not be picked up on radiographs right away. And this typically is going to result in a surgical fixation, and then you'll rehab them through that as well. And I found that plantar flexion is actually the motion that's the hardest to get back on that. So make sure that you are getting on that plantar flexion range of motion early on, and not just focusing on dorsiflexion. You can see those injuries in water skiers as well, or motorcycle injuries, but snowboarding is where I've seen it the most, and that's what the literature supports. So those are, the kind of the brief overview of injuries to the extremities for skiers and snowboarders. Definitely can get some spinal injuries and head injuries too. Prevention of those head injuries, wearing a helmet is key. So educating your community with the importance of wearing a helmet if you're skiing or snowboarding, and get creative with your rehab. Make sure you're bringing in their sport mechanics as well as their equipment, and get out there, enjoy the slopes, and have a great weekend, everyone.